Ciprofloxacin is a second-generation fluoroquinolone used to treat various susceptible bacterial infections. In this video, let's found. What is ciprofloxacin? What is ciprofloxacin used for? Contraindication. What are the side effects of taking ciprofloxacin? How does ciprofloxacin work? How to use ciprofloxacin? What is ciprofloxacin? Ciprofloxacin is a fluoroquinolone antibiotic used to treat a number of bacterial infections. This includes bone and joint infections, intra-abdominal infections, certain types of infectious diarrhea, respiratory tract infections, skin infections, typhoid fever, and urinary tract infections, among others. Ciprofloxacin was patented in 1980 and introduced in 1987. It is on the World Health Organization's list of essential medicines. The World Health Organization classifies ciprofloxacin as critically important for human medicine. It is available as a generic medication. In 2020, it was the 132nd most commonly prescribed medication in the United States, with more than 4 million prescriptions. What is ciprofloxacin used for? Ciprofloxacin immediate-release tablets, oral suspensions, and intravenous injections are indicated for the treatment of skin and skin structure infections, bone and joint infections, complicated intra-abdominal infections, nosocomial pneumonia, febrile neutropenia, adults who held anthrax, plague, chronic bacterial prostatitis, lower respiratory tract infections including acute exacerbations of chronic bronchitis, urinary tract infections, complicated urinary tract infections in pediatrics, complicated pyelonephritis in pediatrics, and acute sinusitis. A ciprofloxacin otic solution and otic suspension with hydrocortisone are indicated for acute otitis externa. A ciprofloxacin eye drop is indicated for bacterial corneal ulcers and conjunctivitis. A ciprofloxacin eye ointment is indicated for bacterial conjunctivitis. A ciprofloxacin extended-release tablet is indicated for uncomplicated urinary tract infections, complicated urinary tract infections, and acute uncomplicated pyelonephritis. Contraindication. Contraindications include taking tizanidine at the same time. Used by those who are hypersensitive to any member of the quinolone class of antimicrobial agents. Used by those who are diagnosed with myasthenia gravis, as muscle weakness may be exacerbated. Ciprofloxacin is also considered to be contraindicated in children, except for the indications outlined above, in pregnancy, to nursing mothers, and in people with epilepsy or other seizure disorders. Caution may be required in people with Marfan syndrome or Ehlers-Danlos syndrome. Side effects. Adverse effects can involve the tendons, muscles, joints, nerves, and the central nervous system. Rates of adverse effects appear to be higher than with some groups of antibiotics such as cephalosporins, but lower than with others such as clindamycin. Some adverse effects may be permanent. Ciprofloxacin was stopped because of an adverse event in 1% of people treated with the medication by mouth. The most frequently reported drug-related events, from trials of all formulations, all dosages, all drug therapy durations, and for all indications, were nausea, 2.5%, diarrhea, 1.6%, abnormal liver function tests, 1.3%, vomiting, 1%, and rash, 1%. Other adverse events occurred at rates of less than 1%. Pharmacodynamic. Ciprofloxacin is a second-generation fluoroquinolone that is active against many gram-negative and gram-positive bacteria. It produces its action through inhibition of bacterial DNA gyrase and topoisomerase IV. Ciprofloxacin binds to bacterial DNA gyrase 100 times the affinity of mammalian DNA gyrase. There is no cross-resistance between fluoroquinolones and other classes of antibiotics, so it may be of clinical value when other antibiotics are no longer effective. Ciprofloxacin and its derivatives are also being investigated for its action against malaria, cancers, and AIDS. Mechanism of action. Ciprofloxacin acts on bacterial topoisomerase II, DNA gyrase, and topoisomerase IV. Ciprofloxacin's targeting of the alpha subunits of DNA gyrase prevents it from supercoiling the bacterial DNA, which prevents DNA replication. Half-life. The average half-life following a 250 mg oral dose was 4.71 hours and 3.65 hours following a 100 mg intravenous dose. Generally, the half-life is reported as 4 hours. Dose. Acute sinusitis. Mild/moderate, 500 mg PO Q12HR or 400 mg 4Q12HR for 10 days. Limitations of use. Reserve fluoroquinolones for patients who do not have other available treatment options for acute sinusitis. Bone and joint infections. Mild/moderate, 500 mg PO Q12HR or 400 mg 4Q12HR for greater than or equal to 4-6 weeks. Severe/complicated, 750 mg PO Q12HR or 400 mg 4Q8HR for greater than or equal to 4-6 weeks. Chronic bacterial prostatitis. Indicated for chronic bacterial prostatitis caused by Escherichia coli or Proteus mirabilis. Mild/moderate, 500 mg PO Q12H or 400 mg 4Q12HR for 28 days. Infectious diarrhea. Mild/moderate/severe, 500 mg PO Q12HR for 5 to 7 days. Empirical therapy in febrile neutropenic patients. Severe, 400 mg or Q8HR for 7 to 14 days. Intra-abdominal infections. Complicated, 500 mg PO Q12HR or 400 mg 4Q12HR for 7 to 14 days. Lower respiratory tract infections. Mild/moderate, 500 mg PO Q12HR or 400 mg 4Q12HR for 7 to 14 days. Severe/complicated, 750 mg PO Q12HR or 400 mg 4Q8HR for 7 to 14 days. Limits of use. Reserve fluoroquinolones for patients who do not have other available treatment options for acute bacterial exacerbation of chronic bronchitis. Nosocomial pneumonia. Mild/moderate/severe, 400 mg 4Q8HR for 10 to 14 days. Skin structure infections. Mild/moderate, 500 mg PO Q12HR or 400 mg 4Q12HR for 7 to 14 days. Severe/complicated, 750 mg PO Q12HR or 400 mg 4Q8HR for 7 to 14 days. Urinary tract infections. Acute uncomplicated, immediate release, 250 mg PO Q12HR for 3 days, extended release, 500 mg PO Q24HR for 3 days. Mild/moderate, 150 mg PO Q12HR or 200 mg 4Q12HR for 7 to 14 days. Severe/complicated, 500 mg PO Q12HR or 400 mg 4Q12HR for 7 to 14 days. Limitations of reserve fluoroquinolones for patients who do not have other available treatment options for uncomplicated urinary tract infections. Urethral and cervical gonococcal infections. Uncomplicated, 250 to 500 mg PO once. Anthrax infection. Post-exposure therapy. Inhalation, prophylaxis/post-exposure 500 mg PO Q12HR or 400 mg 4Q12HR for 60 days. Cutaneous, 500 mg PO Q12HR or 400 mg 4Q12HR 60 days. Plague. Indication for treatment and prophylaxis of plague due to Yersinia pestis. 500 to 750 mg PO Q12HR x 14 days, or 400 mg 4Q8-12HR x 14 days. Bronchiectasis, orphan. Orphan indication sponsor. Iridium Corporation, 3929, Point Eden Way, Hayward, California, 94545. Non-cystic fibrosis bronchiectasis, orphan. Dry powder for inhalation, orphan designation for patients with NCFB who suffer from frequent severe acute pulmonary bacterial exacerbations which lead to further inflammation, airway, and lung parenchyma damage. Safety advice. US FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about ciprofloxacin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.